Senate Print 1883A, an act to amend the insurance law.
Read the last section.
Section 5, this act shall take effect on the 60th day.
Call the roll.
Adams, D. Francisco, Libous, Sampson, Skells, Zeldin.
Senator Flanagan to explain his vote.
Thank you, Mr. President. Mr. President, this has been commonly referred to as the breast density bill. And to my colleagues, I appreciate anyone who will be voting in favor of this. A lot of times we get legislation that we introduce as a result of things that happen to people in an adverse way. And I have had the privilege and good fortune of meeting a woman named Joanne Pushkin from my home community who, as a result of a misreading and an improper diagnosis, has had to battle cancer for a number of years. She's doing well, she's a delightful individual, and she has channeled her energies into working on issues like this. And this is one of the few times I feel comfortable getting up and saying, even though someone will say this is an insurance mandate, I firmly believe that this will save costs in the long run because you're going to get better readings, you're going to get better information, and this is more in the line of prevention and getting something addressed before something negative happens rather than after the fact. This issue is gaining a lot of notoriety across the country. New York, by passing this law, will be ahead of many other states. And I will say this, I've learned a lot about this issue in talking to people, and particularly advocates in this area. And one thing that really struck me more than anything else is that most women are unaware of this whole issue. There are roughly 50% of women who have quote-unquote dense breasts, and many of them don't even know that. So the notice provisions here and the additional coverage will go a long way towards protecting women, hopefully not only just in this state, but across the country. Mr. President, I am voting in the affirmative. Thank you.
Thank you, Senator. Senator Flanagan's vote will be recorded in the affirmative. Senator Kruger.
Thank you. I rise to commend the sponsor of the bill for movement of the bill to the floor, and hopefully it will become the law of New York State. When I entered the New York State Senate about 9 years ago, I was fighting for the passage of the Women's Health and Wellness Act, which would finally have allowed any mammography coverage mandatory in New York State insurance. And the technology has improved, and the models for how to detect breast cancer in women and men have moved forward. And on behalf of statistically a huge percentage of the women in New York State who may in fact face a diagnosis of breast cancer at some point in their lives, this is a very important bill to pass. And yes, there are insurance companies who object and who are opposed to new mandates on health insurance, but if you look at the statistics on breast cancer, if you look at the statistics on unsatisfactory diagnosis early on, particularly among women who have denser breast tissue, clearly in 2011 the technology is available to ensure that all women get correct diagnosis, and it is the responsibility of this state to ensure that insurance coverage is there for every woman and the statistically still small number of men who may also face breast cancer. So I'm very glad this bill is passing today. Thank you. I'll vote yes.
Thank you, Senator. Senator Kruger's vote will be recorded in the affirmative. Senator Hazel-Thompson.
Thank you, Mr. President. I rise to commend Senator Flanagan on the passage of this bill, primarily because, as you heard from Senator Liz Kruger, the numbers of women who, in their first stage of diagnosis, have masses in their breast, and even though at that time cancer is not clearly indicated, what these follow-up tests will do is to help to monitor and make sure that we catch as many women as we can in the very early stages. It is so tragic when women don't become aware until stage 4, and it's too late to do anything about this disease. But certainly he is to be commended, and I am very proud to be one of the people who will be here to vote for this bill. Thank you, Mr. President.
Thank you, Senator. Senator Hazel-Thompson will be recorded in the affirmative. Next, Senator Montgomery.
Thank you, Mr. President. I rise to also thank my colleague, Senator Flanagan. It's very personal because I'm one of those people who has the issue of dense breast tissue, and it's been very often problematic in the general way of having the mammograms. So I thank you for myself and for certainly many of the other women who have the same issue and now will be able to have their insurance company cover the cost of the ultrasound. So certainly I'll be voting in the positive and want to say I'm very happy that I'm able to vote yes on a bill that has such an important personal impact on my own life. Thank you, Mr. President.
Thank you, Senator. Senator Montgomery's vote will be recorded in the affirmative. Next, Senator Bonasek.
President, I too would like to compliment Senator Flanagan for this legislation. I see it as an expansion of the Women's Health Bill that we did back in 2004 when we required insurance companies to have coverage for women for osteoporosis, breast cancer detection through mammograms. And what we found out then, and what you all know, is that when a man or a woman has breast cancer, and I think the incidence of a man is 1 in 8, and women is much more predominantly in having it, the costs are astronomical on the back end of trying to cure the woman or at least contain breast cancer. What this legislation does, it's educational, it's preventative, and I think in the long run it will help diminish health care costs for those individuals that are fortunate because of this legislation to detect the possibility of breast cancer and get it early, prevent it, and lead a very healthy life. So thank you, Senator Flanagan. I vote in the affirmative. Thank you, Mr. President.
Thank you, Senator. Senator Bonasek's vote will be recorded in the affirmative. Senator Oppenheimer.
Thank you, Mr. President. Actually, Senator Bonasek said a good deal of what I was going to say, that in the long run, this is a cost saver. We know that if we can catch breast cancer early, it doesn't metastasize to the extent where very radical procedures are necessary. And I am one of the fortunate survivors of early detection of breast cancer, and here I am 24 years later, and very happy to support Senator Flanagan's bill. Thank you, John.
Thank you, Senator. Senator Oppenheimer's vote will be recorded in the affirmative. Senator Laval.
Thank you, Mr. President. I want to congratulate Senator Flanagan on this. One of the, I think as everyone knows, early detection is a key. And I was thinking when Senator Bonasek was talking, because he was right on target. Many years ago, there was a Fram oil filter ad on television. Pay me now or pay me later. So this actually is a measure that will save money in the long run, but most importantly, it will save lives. I vote in the affirmative.
Will be recorded in affirmative. Any senators wishing to speak on this bill? Okay. Secretary will announce the results.
Ayes 57.
Bill is passed.